Of course, just as I'm getting ready to go live, the goat in the restaurant next door started up. I think it stopped now. The reason I'm going live is not to talk about goats though, it's to talk about what to do when you get some blood work done with your GP because you've gone to the GP, you're not feeling well, you've got some symptoms, or you're just generally feeling shitty, and your blood work comes back and the GP says, well, everything's normal, everything's come back normal. So that's that, and I've seen on social media, sometimes they have memes, like when the doctor says your blood work is normal and it's someone drowning and the doctor like high fives them as they're drowning because the doctor, your GP, is actually looking for a disease when they run your labs, right? So they send your blood away, the lab run the tests, and then send back, those big documents that come back with all of the reference ranges in them. And your doctor is looking for one of two outcomes, right? Either there's nothing wrong in terms of a disease picture, in which case that's good, or you have a disease and they give you medication, or they send you off to a specialist for further investigations. So the ranges that are presented in those reports are pretty broad, because people are different. And so you have this broad range, and if you happen to fall inside it, your GP, who's trained to look for and treat disease, not to prevent disease, should they be looking to prevent disease? Probably, maybe, that's a totally different discussion, but the fact is they're looking for out and out disease in your lab results. So when they don't find it and you feel crappy and you feel like something's going on, what you can actually do is ask for your results. You paid for them either with your taxes or with money. So just ask to have your results sent to you. Most doctors have no problem with it. And if they do have a problem with it and you apply some pressure and they still refuse to release them to you, you can actually go and get your blood tested through private labs, and then you own the information. And go and find a practitioner who works, I guess the keywords are like a functional medicine practitioner. So within those ranges, you've got disease on either side, and then inside that you'll have what we call functionally optimal ranges, which means if you're operating outside of kind of the perfect range really, then you could feel unwell, you could have symptoms. Do you have a disease? No, but your numbers, your results are showing us that there is stuff that we can do to help you feel better. So you either are looking for a functional range, or you could even have what we call a subclinical disease, meaning you're right up to the edge of normal. Take the thyroid, for example. The thyroid range is from about like 0.5 to 5, I think it is now. They lifted it. So functionally optimal is around 2, depending. If you're on a fertility path, then we sort of want that to be around 1.5. Subclinical hypothyroidism is where you find the range up around 3 or 4. Your doctor's like, well, it's still within range, so it's fine. But a functional medicine practitioner is going to look at that and go, you know what? I think we need to do some more digging in terms of tests, or they might have some suggestions for you depending on what you're looking at, whether it's fasting blood glucose or iron studies, vitamin D, etc. So when your GP comes back to you and says everything's normal, but you don't feel normal, ask for your blood work and then go and find someone who can help you to do a little bit more digging. No goat. We made it through. Thank you, and I will see you on my next live. If you have any topics that you would like me to talk about, please put them below, because that helps me when figuring out what I can share and what's helpful and relevant for people.